Question number 1. The primary focus of community health nursing is. The right option is option C, preventive and promotive care. Question number 2. Which level of prevention focuses on early diagnosis and prompt treatment? The right option is option B, secondary prevention. Question number 3. Community health nursing is based on the principle of. The right option is option A, health promotion and disease prevention. Question number 4. The concept of primary health care was first formally introduced in. The right option is option B, Alma Ata Conference. Question number 5. Which is not a principle of primary health care? The right option is option D, use of costly technology. Question number 6. The Health for All by 2000 AD declaration was made in. The right option is option D, 1978. Question number 7. Which of the following is an example of tertiary prevention? The right option is option B, rehabilitation after stroke. Question number 8. In community health nursing, the smallest unit for planning services is. The right option is option B, village. Question number 9. Which of the following is a key feature of community-oriented nursing? The right option is option A, focus on the family and community. Question number 10. Which is an example of secondary prevention and community health? The right option is option B, early diagnosis of hypertension through screening. Question number 11. Which is the first step in the nursing process in community health? The right option is option B, assessment. Question number 12. The ultimate goal of community health nursing is. The right option is option C, to improve the health status of the community. Question number 13. Which of the following is not a role of a community health nurse? The right option is option D, surgeon. Question number 14. In public health, incidence refers to. The right option is option B, the number of new cases in a defined period. Question number 15. Which agency is primarily responsible for international public health? The right option is option B, WHO. Question number 16. The most important indicator of community health status is. The right option is option A, infant mortality rate. Question number 17. Which of the following is a principle of community health nursing? The right option is option A. Care should be based on community needs. Question number 18. School health services comes under which level of prevention? The right option is option A. Primary prevention. Question number 19. The best method to control communicable diseases in a community is? The right option is option A. Mass immunization. Question number 20. A community health nurse is visiting homes for postnatal care. This is an example of. The right option is option C. Tertiary prevention. Question number 21. The nurse-patient ratio recommended by WHO for community health is? The right option is option B. 1:5,000. Question number 22. Which health indicator reflects the quality of maternal health services in a community? The right option is option A. Maternal mortality rate. Question number 23. The first and most essential element of primary health care is? The right option is option A. Provision of safe water and sanitation. Question number 24. The concept of epidemiological trend includes? The right option is option D. Agent, host, environment. Question number 25. Which community health principle stress that health services should be accessible to all without discrimination? The right option is option B. Equitable distribution. Question number 26. The expanded program on immunization EPI was launched by WHO in? The right option is option A. 1974. Question number 27. A nurse is collecting data about water sources in a village. This step belongs to which part of the nursing process? The right option is option D. Assessment. Question number 28. Which is the best measure for assessing the burden of a communicable disease in a community? The right option is option A. Prevalence rate. Question number 29. Which factor is not part of social determinants of health? The right option is option C. Genetic mutation. Question number 30. Which of the following is the most sensitive indicator of community health? The right option is option A. Infant mortality rate. Question number 31. Which is not a component of primary health care according to Alma Ata Declaration? The right option is option C. Specialized surgical services. Question number 32. Which prevention level includes occupational therapy after injury? The right option is option D. Tertiary. Question number 33. The main function of a sub-center in rural health services is. The right option is option B, preventive and promotive health care. Question number 34. Which health team member is responsible for immunization at the primary health level? The right option is option B, ANM, auxiliary nurse midwife. Question number 35. The term community diagnosis refers to. The right option is option B, identifying health needs and problems in a community. Question number 36. Which of the following is an example of secondary prevention in maternal health? The right option is option D, ANC checkups to detect pregnancy complications. Question number 37. Health education in the community is best carried out by. The right option is option B, face-to-face interaction with active participation. Question number 38. Which indicator is used to assess the nutritional status of children under 5 years? The right option is option B, weight for age. Question number 39. Which is a limitation of community surveys? The right option is option D. They require more time and resources. Question number 40. The slogan Health for All was adopted by WHO in. The right option is option B, 1977. Question number 41. Which document first defined primary health care? The right option is option A, Alma Ata Declaration. Question number 42. The most effective method for controlling a measles outbreak in a community is. The right option is option B, immunization. Question number 43. Which of the following is not a function of a community health nurse? The right option is option C, major surgery. Question number 44. Which prevention level focuses on avoiding disability after disease? The right option is option C, territory. Question number 45. Which method is best for prioritizing community health problems? The right option is option A, community scoring and ranking. Question number 46. The health team approach emphasizes. The right option is option B, coordinated multidisciplinary care. Question number 47. Which factor is most important for the success of primary health care programs? The right option is option B, community participation. Question number 48. Which level of prevention is vaccination considered to be? The right option is option A, primary prevention. Question number 49. The term incubation period refers to. The right option is option A, time from infection to appearance of symptoms. Question number 50. Which is a key principle of health education in community health nursing? The right option is option A, tailoring messages according to cultural backgrounds.